For the SVT algorithm, I will begin with my scene size up. Then I will begin with my primary assessment. I will determine the patient's chief complaint and level of consciousness. I will ensure that ABCs are intact. The patient will then be taken to the ambulance where an IV can be established, vitals will be taken, and they will be placed on a cardiac monitor. I will interpret the rhythm, and for the purpose of this assignment, it will be supraventricular tachycardia. With this information, my general impression of the patient, I will then look for serious signs and symptoms, which are altered mental status, heart failure or JVD, chest pain, hypotension, or signs and symptoms of shock. If the patient does not have any of these signs, I will ask them to bear down using Valsalva's maneuver. If that doesn't work, I would administer adenosine at 6 milligrams rapid IV push, elevate the arm, and follow with a flush. With administration of adenosine, I'm also being sure to print a strip. I can then follow that with 12 milligrams rapid IV push followed by saline flush. If that doesn't work, I can administer cardizem at 0.25 milligrams per kilogram initial dose, followed by 0.35 milligrams per kilogram in 15 minutes if necessary. If the patient appears or becomes unstable, I will consider adenosine and then place the pads for synchronized cardioversion. I will consider pain management or sedation before performing. I will begin at 50 joules for the shock, being sure I hit sync and hold in the shock button to avoid an R1T phenomenon. I can then continue to administer shocks, increasing by 50 joules until I have a rhythm change. After rhythm change, I'll administer an amiodarone drip at a 1-to-1 concentration.